Choosing an ostomy bag in today's world sort of has the double-edged sword of having a lot of options. And this is really great because it means that there have been many new products released in the past years and that we now have the opportunity to find what works best for us and what fits best to our body. And so while I really appreciate this, it also means that there can be an overwhelming choice, especially for new ostomates, in trying to figure out what does work best for you. You have options of one piece or two piece, opaque or transparent, close-ended or drainable, and then you deal with all the different brands and things like that as well. And so while it would probably be too much to go into all of that in one video, I thought we'd start off by talking about the differences between one pieces and two pieces and why somebody might choose one over the other. And so for today's examples, I am using Coloplast and Urology pouches, just in the hopes of kind of comparing apples to apples across one brand and looking at the different options that there are as far as one pieces and two pieces go. So right now I have on the one piece pouch. I actually started off when I first got my ostomy with wearing a one piece for the first few months. And the reason that I liked it a lot is because it does sit very close to the body and much easier to conceal underneath clothing. And please keep in mind that I am several months pregnant at this point, and so it does stick off a little bit further than it would before. So honestly, it usually will even lay flatter than it is currently. So looking at the one piece, it's exactly what you would think. It is the barrier wafer connected to the bag, all in one simple piece. And some of the benefits of this is just the simplicity of it. It's very easy, it's not complicated. You've got one bag and one piece that you have to deal with and account for. You don't have to worry about running out of one piece or the other. You always have, know exactly what you have with this. Another benefit is when you're purchasing ostomy bags, they can start to get expensive. And a lot of times, depending on your insurance, of course, you may be able to get a better deal on just buying the one pouch complete in one piece rather than having to buy the two separate pieces. So those are some of my favorite things about it, is just the low profile of it and really the simplicity of it, which is great. Some of the things, though, that might make the one piece pouch a little more difficult, for me, I always get cut to fit. I've never been one who just orders it already pre-cut because my stoma tends to change sizes slightly. And so I like to be able to just cut it each time and kind of know exactly what I'm dealing with and make sure that it fits just right. But because of this, it can be a little difficult cutting a one-piece pouch, and you really need to kind of pull it away from it, the bag away from the wafer a little bit in order to cut it and make sure that you don't accidentally snip the bag as you're doing it. Also, because you're putting it all on in one piece, it is sometimes difficult to see exactly where you're lining it up, and can make it difficult just to make sure that it is not too far over or one direction or the other. However, on the new Mio pouches, the front window can definitely help with that because you can see a lot more of where you are placing it without having to have a completely transparent bag. The other option that we have is the two-piece snap, which you can see here comes with a wafer that has a ring around it. And there is a ring on the inside of the bag as well. And you literally place them together and snap them into place. It also does have an extra lock on here that closes in just for added security so that you know that it is definitely locked in place and it's not going anywhere. To take it apart, it has this plastic tab, and once you unsnap it, it literally just pulls apart like that. So what's great about the two-piece is especially in placing it. Once you have the ring cut out, whether you have it pre-cut or if you do the cut to fit like I do, you really have a great view of being able to place it over the stoma and see exactly where you are placing it, because you have kind of the view from this angle on the inside, as well as especially if you're using a mirror to do it from the outside, and can just make sure that it's really centered and snug up against the stoma there. Another great part about the two-piece system is that since it can pull apart like I just showed you, you do have the option of changing out the bag if you ever needed to. This could be because you are using a closed pouch system, which I don't have any examples of today, but basically they are a smaller bag that you can use. I know a lot of people like to use them when they are out at the beach or the pool or somewhere like that they really want something low profile. But these bags literally have to be just taken off and thrown away and a new bag attached. They are not something that can be emptied at any point. And so it is very easy just to pull that off and do it. Or if anything happened to the bag, if it got caught on anything, or if you just felt like it wasn't working well, but the barrier is still doing great, it is nice to have that option of being able to take it off without having to actually take off the entire system. Another really cool thing about this is that you can move the bag around. So see here, if I have it on, if you unsnap it, you can twist the bag into different directions. So say when you're sleeping, if you want it to more of lay flat this way, you have the option of being able to do that. And then when you get up in the morning and need to empty it, you can just spin it back around to whatever area you want, relock it into place, and you're good to go. Some of the things that I know that people may not like as much about this system is that the base, since it does have the plastic ring on it, is a little bit more rigid. So especially for people who are really active, maybe doing like yoga classes and things like that, it can be a little non-bendable when you try to do things, as well as if you lay on your stomach for things, it might be a little bit uncomfortable like that. It also, just because it is this structured ring, when you're wearing it over tighter clothes, it does push out just a little bit more, and on occasion you can see a little bit of a ring. Usually not something very noticeable, but for anybody who is self-conscious about that, that might be something to keep in mind. And also the two-piece does stick off the belly a little bit further. But you can see that this is not quite as flat to the body, as flush as the one-piece system is. And then there is a third option, and this is another two-piece system. This one is exclusively from Coloplast. It's called the two-piece flex. And basically how this one works is you have the wafer here that has this kind of like bendable piece on here, and then you have the bag that has tape, and when you pull that off, it is sticky underneath, and you basically just stick the piece onto the other one. So you still get the same, ability to cut this out easily and be able to place it a little better exactly where you want it, make sure that it is lined up around the stoma without having to worry about not being able to see through the front, and then you can place the bag on from there. So some of the things that I really like about this system is that I feel like it pulls in sort of the best of both worlds, of having that two-piece system that is just a little easier to kind of deal with and place, while at the same time allowing for a lot of flexibility and bend. As you can see here, this piece is very flexible. It's not rigid, so when you have it on, it's really easy to move around in. You don't feel like it is pushing through any of your clothing. Also, especially if you're wearing something tighter, it does lay very flat and close to the stomach. And then some of the differences from it and the snap two-piece is that when you do stick it, it is kind of much more in one place. As I showed you with the snap, that you do have the ability to move the bag around and very easily take it off. It is a little more complicated with this one. You can't, once it's stuck on, it's there. You cannot move it around, you cannot twist it. You do have the ability, it has a tab on it, so you do have the ability to take the bag completely off and put another one back on. I know some of the concerns with this one is as far as actually lining it up, and if there is going to be any kind of a leak through this sticky side here. And this is the bag that I personally wear. It has done very well for me, and in the past 2.5 years or so that I've been wearing it, I have had something leak through the stickiness maybe twice. So that is really not something that is a common issue. And a lot of times more just has to do with whether or not you got the bag on correctly in the first place. And as long as you are able to get it on and get it on straight, you're usually not going to have any kind of an issue with something like that happening. Another thing is, I've heard some concern about whether or not the bag will just stay stuck on. And it really does. I have never once had a problem where it started to peel off or anything like that. As usual, you're usually only going to get the peeling from the wafer that you're going to get from any product that you have, and not from the bag itself. So as you can see, this is sort of how the system is set up, with the two pieces stuck together here, and then the wafer underneath, and just a lot of flexibility there. So there's really a quick overview of what you were looking at when trying to determine what type of ostomy bag system you want to use, whether a one-piece, a two-piece flex, or a two-piece click system. And I would definitely recommend giving all of them a try, spending a little time with each one of them. You can get free samples of all of these products, so that way you can really see what works best for you, figure out what's comfortable, what way you like putting the bag on, and all of that. And I think a lot of times it just takes some time to try them out and see what works best for you, because I know that what works for one person isn't necessarily going to work for everybody. So that's why it's really great that we have all of these different options out there now. And I also want to hear from you. What sort of factors went into play when trying to decide what type of bag to use? And so feel free to put that in the comments. Love to hear from all of you. I think it would be a really big help for people who are in the midst of making this decision to understand kind of what the benefits are of each one of them.